everything that in our power to make them as happy and fit as possible. Yet, again, like we talked, we sit at a desk or we work 40 hours a week. Most of us, except for the lucky ones who get to make a living at this day in and day out. But even then, there are certain risks that go with our sport. So in equestrian sports, what role does physical therapy have? Of course, we can rehab from injuries that we acquire from our sport, as well as teach us ways to prevent injury. We can educate you on your current fitness level, as well as what restrictions you may have at this time and what might be holding you back from achieving your next level of fitness, as well as prescribe you specific interventions, which are exercises, stretches, modalities, that can actually help enhance your performance. What exactly is the equestrian athlete? I guarantee all of us at some point in time have been told, horseback riding, that's not a sport, the horse does all the work. Yeah, right. We all can say that, after a hard ride on a horse that's been challenging, or even just a long day at a clinic, our body tells us that we are doing a lot of work. But what way do we treat ourselves actually like athletes? Too many times, again, our primary function is on the horse and how our horse is performing, yet we neglect ourselves. And again, we are part of the team. Your team's only as strong as the weakest link. So I'd like to just take a quick minute and ask you guys to maybe throw out some things that you have done for your horse in the past year, 2 years, as you were kind of getting them ready for the competition season, or if they had a setback, things that you did to help them get better. Has anybody done anything for their horse?
My horse gets massages way more often than I
do. Exactly. Anything else like that?
Acupuncture.
Acupuncture, exactly. Chiropractic, and again, now there's even the aquatics facilities for when your horse needs to, do some rehab, but again, you want to control their weight bearing. You're exactly. There were over 100,000 injuries that were reported to the ER. 66% of these injuries occurred while we were riding the horse or in the act of riding, most commonly obviously falling off or being thrown from a horse. The areas that were injured most commonly were our head and neck, the lower extremity, and our upper extremity, with the primary diagnosis being abrasions, contusions, fractures, all of which I'm sure we've suffered at some point in our riding career. Now while that's 61%, what happened to the other 34%? Or 34,000 of us that went to the ER between 2001 and 2003. Other types of injuries are happening. So another article that was published in the American Journal of Sports Medicine compared a group of elite riders to a control group. And for those of you who don't know what a control group means in scientific research, is just a similar demographic compared to the group that you want to study. So what they found was of the elite riders, 88 had a history of low back pain. And only 33% in the control group reported the same type of low back pain. That's a pretty high, significant difference when you're comparing demographics. So what the researchers did was they did MRI studies on all the participants. And again, you would expect maybe to see some type of common injury or pathology happening in the rider's back to cause such a high reportance of pain. However, there was no significant increase in findings in the MRIs between the riders and the control group. Yet we do report of having more low back pain. There's just no specific injury that can be related to our sport. Instructors, again, published in the year 2009, studied a group and asked again about pain. The average age of this group were 33-year-olds, again, about the common age of the trainers that are out there now instructing and giving lessons and running farms and training programs of their own. 91% of these reported pain within the last 12 months, and 55% reported pain in the last week. And again, it wasn't the act of riding, it wasn't standing teaching lessons, it was the stuff we do on a day-to-day basis that caused most of our strain and pain, which we then take into our riding. The activities that were reported to cause the greatest strain were mucking, again, handling shavings, carrying water buckets, all the heavy bending, lifting type work we have to do to maintain our farms. What that basically means is, yes, our sport, does give us a way of exercising and we do train certain muscles, but if we spend just a little bit extra time maybe fine-tuning or going for our areas of weakness, we can cut down our incidence of injury. So injury prevention. No other sport do we see people just going straight onto the field and participating in their sport. Again, picture of Phil Mickelson before he takes a golf course, Derek Jeter and A-Rod stretching. Again, their trainers tell them what they need to do to properly warm up before they take the field. And even watching the Summer Olympics, you see the swimmers warming up and stretching before they take the block. We would never drive up to a competition, take our horse right off the trail unless we're running really, really late, and go straight into the arena. We always try to warm our horse up so that they can perform at their best. So what we need to do is condition and prepare ourselves to do just the same. might be a new concept to some, or you may already do that if you've played sports in the past. I guarantee all of us do participate in some form of sport-specific training, but it's for our horse. So again, what's the first thing we do when we get on our horse for a ride? We warm them up, correct? All right. So during a session, what are some other things we work on? We work on their flexibility, their suppleness. We work on their strengthening, their balance. Left, right. We work hills, up and down. Again, endurance. We do our conditioning program so that they can safely get through dressage, cross-country, stadium all in one day and be able to be fine. As well as we work on their strength, grid work, hill work, as well as their accuracy and timing. And again, we would never put our horse straight back into the stall without pulling them down. So now what I want to do is take that concept and show us how we can do it for ourselves. Warm-up is probably the easiest thing that we do, and we probably aren't even aware that we do participate in some form of a warm-up. A warm-up increases our muscle temperature, it increases the oxygen demand to our muscles, and therefore it actually increases our flexibility and decreases strain on our joints. So something as simple as walking out to the field to get your horse or giving him a nice vigorous grooming. You guys all feel in the cold weather, again, we get warmed up, our body temperature does increase. So that part's kind of already done for us. And then if we just threw in a few stretches and static stretching, again, for areas that we typically are a little bit tighter, it's a perfect time to do that. A little bit about the muscles that we use when we're riding. Where have you all felt some stretch or strain during your, time as an equestrian? Shoulders, back, thighs, exactly, calves, exactly. Pretty much our whole body at some point has felt a ride. Exactly. Again, areas that maybe shouldn't feel as much if another area was stronger. Exactly. So pretty much head to toe. We've all felt those, or especially when we've hit the ground, our body tells us even more. So what I want to do is we're going to break down these muscle groups, and I want to talk about why stretching to these groups is so important and what actually it does with our riding. So our gastroc, which is the most, I don't know if you guys can see, it's the most superficial muscle in the top of our calf, and then the soleus is actually deeper. But they both come together to form our Achilles tendon. And I'm sure you guys have all heard of people who do injure their Achilles. It's a pretty serious injury, and you can obviously understand why it would limit our sport. We'll talk about quadriceps and hip flexors. Again, for those who don't know, the front group, hamstrings in the back, the glutes and the hip rotators are very important. The pec muscles, our lats, as well as our abdominals, and then the upper back, which is the rhomboid group. Again, like I mentioned, there are two different muscles. You have the gastroc, which is on the top. The soleus is deeper. They both come together to form the Achilles. Proper flexibility allows for that nice, deep base of support we want in the stirrup. And also, again, proper flexibility will allow healthy stretch to the Achilles when we're landing over a fence, or again, the horse shies as we put our foot down in a stirrup, and help decrease excessive strain. Moving up to the quadriceps and hip flexors. Again, the quadriceps start kind of below your knee, run up the front. There are muscles there that are considered hip flexors, and they actually attach onto the front of our pelvis. If we have tightness in our quadriceps, it actually can cause a forward rotation of your pelvis, which will then do what? Lift our seat bone out of the saddle, making it more difficult to really use our seat in as effective aid. You can see in this picture, again, the nice level pelvis would show having equal length of your quadriceps and hamstrings. To the right, again, you see if you're shortened in the muscle group down the front of the thigh, we get that forward tilt. It increases actually the angle of our lower back, which increases strain. Our backs are not meant to function with that high of an angle. So sitting trot, landing over a fence, we're adding a stress point to our spine. And if you think back to that MRI finding, again, strains and sprains aren't really going to show up significantly on an MRI, maybe compared to a group of, regular people that aren't riding. But you can see where this would potentially introduce an area where we'd have some pain. Opposite of the quadriceps, we get the hamstrings. Hamstrings, again, from below the knee and come up and actually attach onto our seat bone. They have the opposite effect as the quadriceps and hip flexors. And again, a tightening of the hamstrings causes a backward rotation of our pelvis. Again, it's a little blurry, and I apologize for that, but I like, again, the way this illustration shows that the pelvis actually can rotate backwards. It flattens the lumbar spine, which again is an abnormal position of our body. And again, with the stresses of our sport, introduces another area of pain. Side-by-side comparison of what we just talked about. Again, the tightness in the muscles in the front of the thigh, that clockwise rotation of the pelvis, shortening of the muscles in our lower back, and that increasing of the angle. And then the tightness of the hamstrings, that counterclockwise rotation of the pelvis, it actually, again, flattens the spine and stretches the abdominal wall. Muscles that are on stretch are not as functionally strong, therefore kind of eliminating our core being as true functional as we want it for using our C8s.